Hello everyone, this is Dr. Praveen Tripathi and I'm very happy to be interviewing Dr. Pawan Khande, who recently passed his MD Psychiatry exam. So Pawan, first of all, many congratulations.
Thank you, sir. Thanks a lot.
So Dr. Pawan, you passed the exam and you completed your residency from the Malla Reddy University
Yes, sir.
and you passed the exam. So the reason why I want to talk to you in detail is to understand how conceptual psychiatry was involved in your preparation, what role did it play, and how should it be used by a resident. So please tell us something about it.
Yeah, sure, sir. My name is Dr. Pawan. Good evening, sir. I'm happy to talk to you for
Same
giving
here.
this opportunity. Also, I'm very happy about that. So basically, when we started, I think when I was in first year, it was almost all the textbooks and everything we are preparing from them,
Hmm.
from CTP and all the standard textbooks we are preparing. But the concepts are okay, but still we used to have some or the other
Hmm.
problems while conceptualizing and application in during the clinics also.
Hmm.
But I have started. I took this conceptual psychiatry in second year of my post graduation.
Hmm.
Once I started watching the videos and trying to relate
Hmm.
with my clinics, I started loving the subject more than I used to love psychiatry. And the ease, I mean, I am able to correlate the concepts very easily after being explained
Hmm.
and after listening to the conceptual psychiatrist. I felt very nice.
All right. So, Dr. Pawan, if you look at the app of Conceptual Psychiatry, there are different sections. So, when we
Yes.
started, we made elaborate videos, something that can be used for in-depth knowledge.
Yes.
Later on, we thought that along with these, we also have to help the students in passing the exam. So, we
Yeah.
started getting some rapid revision videos. So did you use both of them, or I mean, how did you use this
Yeah.
content?
Yeah. When I started in second year, I think the elaborated videos were available at that time.
Yeah, yeah.
And I was using that elaborated videos. Almost I finished 50 to 60% of the videos.
Mm.
So after that, before exams, I think 2 3 months before exams, I think that short videos were released, and I think it's a quick revision.
Mm.
It was very useful.
Mm.
Like 2 days we have gap for exam. One day completely I dedicated to just brush up my theories, what all I have I mean, studied before, and what all videos I have watched. It was very useful as a quick revision. Also, it is very nice to finish the concept very fast.
Dr. Pawan, a couple of months back, we started adding the clinical videos. I mean, we thought that let's help students do the long cases better. Because in the residency examination, the entire pressure on the student is during the long case and short case presentation. Theory we still manage, but the practicals are tougher.
Yes.
So we had that thought of one teacher presenting the case, two of them asking the questions. So I want to know your feedback on that kind of presentation. How did it help?
Yeah, it helped a lot, sir. Actually, during our clinics, I think professors will be telling during the rounds,
Mm.
they'll be guiding us what all we have to look through. But we won't be able to noting down everything, and we forget many times, and we write in small papers and leave it here and there. But before my clinics, I mean practicals also during my pre-final exams and final exams, I have watched all the long cases and short cases which are there, and
Mm.
it was very useful for me. I think all the what all questions they are going to ask,
Mm.
most of it is covered in the uh, Viva kind of things. I feel it is more useful for us to once before exam. It is just like an quick exam kind of thing.
Right. Pawan, another thing, when we were conceptualizing the app, the idea was that let's create an app that helps for the exam, but also makes better clinicians. So in many units, we have tried to tell the nuances of the practice and how to approach a case. So I really want to know the feedback on that. That apart from passing the exam, does
Yes.
the app also help you become a better clinician?
Yes, sir. Yes, sir. I actually, my personal view is like before using conceptual psychiatry, I was just reading here and books and all,
Mm.
but understanding was not that great
Mm.
because in psychiatry during MBBS we have never come
Right.
across much of psychiatry, so
Mm.
it's a new subject for us. I was little afraid how I will get through all the things and how will I remember things.
Mm.
But once I started using this, the concept has built for me. I am more happy than passing my exam because I am able to
Mm.
understand the concept, and it will be used for my clinical practice as well.
A QA bank was released with questions and answers a couple of months back. Again, to help the student pass exam. Dr. Sagnik did a wonderful job. He did a lot of effort in preparing those questions. So how was it?
I have used only few MCQs, sir, because like in our
Not MCQs, the long answers questions.
yes, sir. You are talking about notes, sir.
Notes, no, not notes. QA bank,
QA
the
bank.
question answer. Yeah.
Yes, sir. Yes, sir. It was very precisely whatever is required to the answering and all. Whatever is required, it is given very precisely, and I feel it is up to the point what is required than excessively dumping the subject. I feel it is much better in that way, sir.
Wonderful. So, Dr. Pawan, I'm pretty happy to hear that, the concepts part that you keep on saying again and again, that, passing exam is one thing, but residency is not just to pass the exam. Finally, you have to make the transition into being a clinician, and concepts, clinical skills, all those things are more important. So I'm glad to hear that you got benefited by all of these things. Anything else that you want to be added to the app? How can we make it better?
I think it's very user-friendly app, sir. It's not much complications are there. Just once we enter, everything is there on the like a platter where we have to go. What are the concepts and all? I think it's perfectly aligned in perfect way where students easy to like go through the things and all. I think I'm satisfied with the things like with the conceptual psychiatry, with what all they have provided for me for my exam preparation.
So what are your plans for the future, Pawan?
I want to do MRCP. I want to give my MRCP exam soon.
So we are also coming up with MRCP section. You must have seen some videos.
Yes, sir. I have seen few. I have gone through few videos.
Yeah, but it is not completely structured as of today. But probably in a month or two, you'll see that paper A, paper B, everything will be structured along with a good Q bank. So we are working on that as well.
Sure, sir. I think in the notes, sir, I think we have to like there are few important topics which we are missing in the notes. For theory exam. I think if you can please add that also into the...
Yeah, the third volume of notes got delayed because we added so much content later on. So because more content was being added, we were waiting for it to be completed and then release it. But I think we have completed almost the entire notes. Soft copy is there, and it's a matter of time before we print and release the volume 3.
Okay, sir. That will be much beneficial, sir, because if we have everything...
Wonderful, Dr. Pawan. It was really nice talking to you. And please stay in touch, and best wishes for your future.
Thank you, sir. Thanks for giving your time and talking to me.
Thank you.
Have a nice day, sir.
You too. Bye-bye.